about to meet a 37-year-old mother from Hempstead who has a lot to be thankful for, thanks to the medical team you see assembled here at St. Francis Hospital. Diana Parson suffered a stroke 6 weeks after giving birth to her son, Damar. She unknowingly tore her carotid artery during the delivery and subsequently developed a clot on the artery, which led to her stroke.
I didn't have any symptoms of anything. I just woke up to feed my baby, then I just fell over, and that was it. I didn't have any symptoms.
I see her lying on the floor, and I picked her up and put her in the bed. Called her mother, and her mother said she thought she was having a stroke.
Diana arrived with symptoms of having an acute stroke.
She was not able to speak, did not follow any command. She had a right facial droop, which was very obvious, right arm and right leg weakness. We knew something big was going on.
We have protocols that are driven to get these patients to the CAT scan machines for early recognition and diagnosis, receiving TPA, alteplase, or a clot buster. We were able to start our protocol of transferring the patient to St. Francis and the cath lab here.
When we walked in, she was presenting with right-sided weakness, and she wasn't able to speak at all. And we knew that it was an immediate transport. We needed to get her going. It was time of the essence.
Continued our TPA administration so we could do the transition over to here at St. Francis.
We quickly activate our off-hour call team, which is 3 nurses and a cardiovascular technologist, and the team activates, gets here as quickly as possible, and then we hand off care to the team.
The cath lab here reacts as they have over decades to cardiac patients, rapidly bringing her up to the lab.
We quickly placed her on the table, hooking up to vitals.
I looked at her scan, and it showed that she had a blockage on the left side of her brain, the middle cerebral artery, which is one of the larger blood vessels in the brain, and the internal carotid artery, which is also a large blood vessel. We went in through the blood vessel in the leg, up into the brain, and retrieve and remove the blood clot that was stopping the blood flow to the brain.
Then we had to fix the carotid artery, which was also what we were told was the culprit. At that point, we placed a stent. The flow was established to the brain, and she slowly started to move on the table.
And as soon as we did that, she changed from someone who was unable to answer questions, unable to talk, unable to move their right side, to oh, what happened?
I just woke up and seen everybody around me, my friends, my husband, everybody surrounded me. And then little by little, they explained to me what happened, what was going on, and then I understood it after a while.
The following day, when I went to round on her in her room, she was sitting up in bed, chatting with her friends on her cell phone, which was, I think, far beyond what anyone expected in this circumstance.
It became very emotional for all of us, knowing that she's pretty much our age, and it could have been any one of us on that table.
Do we have Diana?
Six hours of her life were gone, but she had the rest of her life to continue. I think it was amazing. And we do that, and that's why we have the protocols. That's why we have the meetings and the conversations with all the different hospitals in the region so that no patient is left behind.
Thank you.